the top 5 health insurance companies, including United Healthcare. They've gotten $371 billion has gone to the top 5 healthcare companies, including United Healthcare, since Obamacare. That more than 40% of that net income went to United Health Group. Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up. Hey, it's Jordan with Status Coup. Happy to be joined by Michael Lighty. He is a long-time advocate for universal health care before Medicare For All became the term. He is a healthcare fellow with the Sanders Institute, and also he is involved with People's Action and their CARE campaign. I wanted to talk to you. Obviously, neither of us are advocating for violence, but clearly what happened with the United Healthcare CEO, his murder, and just the outpouring of response has kind of awoken a sleeping giant in America. And you're somebody who's been fighting the fight for universal health care for decades. So I wanted to go through things that might actually get some attention now, starting with the fact that, frankly, I see the media. Obviously, the media is kind of focused more on the killer, but I don't particularly see the media reflecting the healthcare system accurately. I have seen them talking about, yes, costs are too high, and it is irritating. I've heard when you get denials, but clearly the response to this has shown this is not just about high costs and irritation, but life or death. I want to show you just one kind of factoid here I found, and then kind of get your thoughts from there. But this is from Matt Brunig, the scourge of administrative costs associated with the for-profit private healthcare system. From a design perspective, the main problem with our private health insurance system is that it is extremely wasteful. All healthcare systems require administration, which costs money, but a private multi-payer system requires massively more than other approaches, especially the single-payer system favored by the American left. To get your head around why this is, think for a second about what happens to every $100 you give to a private insurance company. According to the most exhaustive study on this question in the U.S., the Congressional Budget Office single-payer study from 2020, the first thing that happens is that 16 of those dollars are taken by the insurance company. From there, the insurers give the remaining $84 to a hospital to reimburse them for services. The hospital then takes $15.96, 19% of its revenue, for administration, meaning that only $68 actually of the $100 actually goes to care. Translated, this doesn't seem like a health care system. It seems like a health scheme system.
Well, you're right, Jordan. And of course, we were shocked by the horrific act of gun violence and condemn it, regardless of the motivation. But we were not shocked by the outpouring of public anger at the health insurance companies for precisely the reason you say. And Matt Brunig cites the number $548 million each year wasted on administration. And that is higher than lots of federal spending on different programs, like 4 times the amount we spend on what formerly known as food stamps. So this is an issue we've been working on, say, through People's Action, or as you mentioned graciously, my work over the last couple decades. And we have known that there is huge anger out there. And it's rooted in the fact that people are not getting the care they need because these insurance companies are making huge profits. And every family in the U.S. has experienced this. And the media, which has all these resources, is devoting a lot of attention, obviously, to the crime story. But the other crime here is the ongoing reality of life and death for Americans trying to navigate this healthcare system. And they're not even publishing the manifesto of Mr. Mangione. And that gives you a sense that maybe they're reluctant to expose this industry, or at least this man's view of it, which, as we can tell from the social media reaction, is broadly shared. Even if people don't agree with what he did, they certainly understand the same things, which is that this system is denying care when people need it, and they're doing it to make money. And they're profiting off of human suffering, and they're profiting off of life and death.
Right. You know what? I mean, I'm not expecting the media to dig into it. We should note these same cable news networks, as well as legacy outlets. I mean, a lot of their advertisers and sponsors are healthcare companies and big pharma. So a little bit of a conflict of interest there. However, what's interesting to me is there seems to be a new focus on what is the point of sending this money to these insurance companies? Like, for example, right now, depending on your deadline, your deductible renews, right? So you have to start from scratch paying, if you're lucky, $1,000 deductible. If you're unlucky, $10,000. But all those deductibles are largely going to a bloated administrative system and CEOs, not to mention copays, et cetera. And the more people I talk to, a lot of these extra bills, these hidden bills, these surprise bills people are getting are people with health insurance paying for people who couldn't pay the bill. So a lot of these costs are just not actually for care. Again, it's redistributive going to wealthy CEOs and wealthy for-profit companies.
Right. And I think that's a huge source of the public anger. And it's a system that's fundamentally broken because these companies across the board, pharmaceuticals, health systems, and insurers, can charge wherever they want. And the fact is that the insurance companies, again, as Matt Brunig points out, are actually, the purpose of them is to control the cost of providers, right? We pay them so that they manage care. But in fact, what happens is there's a financial incentive on the part of the insurers to have higher rates from providers, because under the law, they can only spend 15% of their revenue on administration, profits, marketing. But of course, if their revenue goes up, that amount goes up. And in the case of having to pay higher rates to health systems, they just build that in, and then the percentage they take off the top is higher in dollar amounts. So they had this notion that they are going to control costs. It's against their financial interest to do so. They're all in the scheme together. The more the pharmaceuticals charge, well, the higher the premiums are, right? And then when it gets a little untenable within the system, as you say, they just shift the cost to the patient. So you have to pay out of pocket to before the insurance kicks in. So you essentially pay for the privilege of coverage, but in order to do so, you first have to pay more.
Right. And I want to point out this from the Lever, who looked into kind of the top 5 health insurance companies, including United Healthcare. They've gotten $371 billion. $371 billion has gone to the top 5 healthcare companies, including United Healthcare, since Obamacare. That more than 40% of that net income went to United Health Group, whose annual profits have skyrocketed by nearly 400%. We've also heard, and I've reported on since this killing, that United Healthcare, not just them, others have now deployed AI to deny more claims. So it just seems to me, we had, in 2016, 2020, when universal healthcare was finally part of the debate, thanks to Bernie Sanders, you just kept hearing this kind of, I viewed it as propaganda, but, people like their private healthcare plans. Well, I mean, you could put a poll, you could phrase a poll however you want it to get the answer you want, but the response sure seems to be people don't love their private health care, or at the very least, they feel that the private health care is, essentially threatening their lives. What are your thoughts how this kind of revisited to the claims that were made by Biden, Hillary Clinton, the media, that, we can't take away people's private health care from them?
What I think people misunderstand about that, Jordan, is it's in the context of a system that creates huge insecurity, and people are literally afraid of getting sick and very afraid of going to the hospital. So in the context of the system and the fear that they experience, they'll grab onto whatever they have. And what they have is their current, usually employer-provided insurance. And so when you say, God, you're going to take that away, you're like, whoa, I'm scared of what could happen. Rightly so. So we have this problem where we have a very clear policy advantage, whether it's in terms of financing, cost control, or just coverage and access to care that Medicare for All would provide. But people are afraid of losing what they have and don't necessarily believe it. And you can tell, obviously, that people are very skeptical of claims made by politicians. Or I think Senator Sanders has much more credibility, but we certainly ran into that. So that's number one. Number two is that there's a huge propaganda machine that supports the private insurance industry, starting with the Democratic Party. They claimed that Obamacare, the Affordable Care Act, was a solution to our crisis. And well, it certainly helped people. It saved lives, no question about it. But it's been a windfall, as the lever points out, for companies like United Health. And so there is also a problem of credibility. We talked about in 2016 and 2020, the politics of resentment. And that anger that's behind that is exposed, I think, in the election results and also in reaction to the shooting. People are angry, and they're angry. They feel like maybe someone else got a better deal in terms of healthcare. Generally, that's the wealthy, of course, but not everyone, even who's wealthy, gets a good deal under the system. But there's a lot of that resentment about the healthcare industry and a lot of anger. And Democratic politicians in particular, who are supposed to be the champions of reform, have fundamentally misunderstood the public's perception of the system. And if they were to credibly offer an alternative and take on the healthcare industry explicitly, they would see, I think, a huge outpouring of support for a universal healthcare system. And frankly, the reaction to this assassination proves it.
Well, I should point out, this is not unique to the Democratic Party. It's plenty in the Republican Party. You messaged me this earlier yesterday. A top Democratic fundraiser is a registered lobbyist for United Health Group, Steve Elmendorf. He ain't the only one, but there was a story on Steve Elmendorf, who has helped Biden, Obama, a lot of the top Democrats fundraising. He's been a lobbyist for United Health Group, among others. And they are part of groups that, like you said, we're talking hundreds of millions of dollars to push propaganda against Medicare for All. And these are the very people. There's another article about him basically cashing in during the Biden administration, his firm and a bunch of others. To be clear, Republican Party takes money from lobbyists, big pharma, for-profit healthcare companies, but sure seems, there is a lot of money coming in to stop even a public option. Remember, Biden ran on a public option. As soon as he got elected, those words were gone. And their big plan during the worst of COVID was expanding COBRA. For those of you that know, COBRA is one of, to me, the most absurd scams in healthcare, where for the privilege of keeping your healthcare from an employer that you just lost your job, you have to pay. I paid at one point $650 a month for COBRA to then keep my healthcare plan that I still had to pay deductibles and copays for that. Most people, particularly during inflation and all that, cannot afford it. So you got both parties essentially, taking the money while telling you, this is best.
Well, yes, and I agree, Jordan. Obviously, the Republicans are completely complicit in the corporatization of healthcare and really driving privatization, say, of Medicare, for example, as the Trump administration plans to expand Medicare Advantage, which is essentially a private option under Medicare that United Health is a huge participant in. But, people have this anger. They see the systems around them that don't deal with the problem, and then they look to the Democratic Party, which is the party of reform, which purports to support universal health care. And it turns out one of the top fundraisers for their congressional campaigns is Steve Elmendorf, who is a lobbyist for United Health. So that's the kind of corruption that I think fuels this politics of resentment. And obviously, the organizations that I work with, we're proud of our work. People should tell their stories about their experience. Careovercost.org is a great place to do that. But ultimately, we're going to have to create a political movement that has power to override the corruption of the lobbyists and the healthcare industry and the hooks they have in the Democratic Party. What I would say, though, to the other side of the aisle, this is a cross-partisan issue. And when Donald Trump Jr. tried to elicit his, social media following in an effort to go after, to find the Mr. Thompson's killer, they weren't into it. They didn't do it. And that should tell, I think, the Trump world, they got a problem too.
I mean,
the health insurance industry.
Just the coverage I've been doing, it's across the board. I mean, liberals, conservatives, libertarians. I mean, it doesn't matter because everyone has dealt with this. You touched on the efforts to privatize Medicare behind closed doors. That has been going on under Trump. His first administration started it. Biden continued it. I mean, this from Jacobin, the stealth privatization of Medicare is a big boon to Wall Street. The Biden administration recently expanded on Donald Trump efforts to privatize Medicare. Now patients are being assigned to new private plans without their consent. I want to show you one example of that we actually covered. So New York City Mayor Eric Adams, when he was not too busy, taking lavish plane rides funded by Turkey, the country, he basically just signed away elderly seniors in New York City who paid into Medicare their whole working lives. He signed away and switched them from Medicare to Medicare Advantage, which is a more privatized system. The courts stopped it. But here is just so you kind of have a taste of what people, not just in New York City, but this is happening in other places, have been dealing with. Here are seniors in a protest we covered against this.
We are as strong and determined as the French. Just like them, we will not give up until we have the health care we were promised. Whoops, I just lost it. The city has reneged on a contract it had with us when we were active workers. The bargain was sacrifice wages now, but when you retire and when you need it most, you will have publicly funded, premium-free, quality health care. Yesterday, with one stroke of his pen, and no doubt to preempt this rally, the mayor broke that contract with us and instead signed a contract with Aetna. A private, for-profit health insurance company under investigation for fraud and whose loyalty is not to its clients, but its shareholders. Their bottom line is more important than our lives.
There is an African proverb that says, working together, the ants ate the elephant. Let me say it again. Working together, the ants ate the elephant. Now, we are the ants. We symbolize right and justice. And the city bureaucracy, the healthcare companies, the insurance companies represent the elephant.
So there you get a taste. That's in New York City, biggest city in the world. Can you kind of elaborate more? Because this has been going on in both administrations, federally and now on city levels, state levels. that you have a lot of this marketing and millions of dollars. I mean, you see celebrities in commercials for Medicare Advantage. Well, these are not entitlements. People paid in to get Medicare, yet they're being pushed more and more to more expensive privatized plans.
Well, it's a particularly nefarious scheme because for each recipient who goes into one of these private Medicare Advantage plans, the insurance company gets an additional payment from the government, taxpayer payment. And that represents a substantial increase in costs to Medicare. So that as they privatize Medicare, and half of the beneficiaries now are in these private plans, the costs actually go up. And that leads to a very disingenuous argument that, well, we've got to go to Medicare Advantage to save money, but they never look at the actual numbers, which is really, it's about $90 billion a year extra overall that's paid into these private plans over those same recipients being in traditional Medicare. So the idea, it's a neoliberal idea, the ideology that says the market always knows best, private is always better than public. In this case, like in healthcare generally, public is actually better. And the problem with Medicare Advantage is also that they have narrow networks. In traditional Medicare, you can go to any doctor you want, basically. In a Medicare Advantage plan, they have a limited set of doctors that you can go to. And you may find as you get a procedure that some of the doctors that are involved are not in that network, and then you're going to pay hugely for it. Medicare Advantage plans also have high co-payments, and you can end up in a extended hospital stay with literally tens of thousands of dollars owed, which wouldn't happen if you got traditional Medicare, and particularly then if you got a supplemental plan that would cover those copays. So it is quite problematic, the level of bipartisan support that Medicare Advantage has. And just as that report said, there are Democrats, including the president and including a good chunk of the Democratic caucus in the Senate, who have consistently supported and encouraged the expansion of Medicare Advantage. The only thing that's happened recently, and the New York case is a very good example, is that started to turn. The Physicians for a National Health Program have done a very good campaign. There are fewer members of Congress signing on to the pro-Medicare Advantage letters that the insurance industry circulates. There's more scrutiny of these plans, even on a bipartisan basis. Senator Warren, I think Senator Grassley on the Republican side, are starting to question whether in fact taxpayers are getting a good deal. And their constituents are starting to talk about, hey, my doctor's not covered. I have to go through prior authorization, which doesn't occur in traditional Medicare. Sometimes my treatment plan is not approved by these plans. And that's part of the whole care denial problem that United Health is notorious for. So between prior authorization, care denials, and a rigged appeal system, when you are denied care, which is controlled by the insurance companies, you get the idea, hey, the whole system's gamed against me for their profit.
Right. I want to play this clip. This is from Pod Save America. The only reason I'm playing it is the guy saying it is John Favreau. He was the speechwriter for President Obama when he won in 2008. He was involved in the, as they call it, the fight for Obamacare. And he said something which, in my view is, casual propaganda, but it's been deployed to make it seem like Americans, are scared of universal health care for specific reasons. I'll play this and then get your thoughts on the back end.
Just to put some statistics there, Kaiser Family Foundation did a very large poll June of 23. 81% of people give their health insurance a rating of excellent or good. Now, if you're in poorer health, that number falls, but it falls to 68%, still pretty high. 58% say they've had a problem with their health insurance in the last year, though half of those people say it was resolved to their satisfaction. And then 27%, so 1 in 3 people say in the last year they've had a specific issue with a claim denial or the insurance company paying less than they had hoped the insurance company would pay. Clearly a problem. To your point, though, let's talk about what's happened. Let's talk about what the barriers are, right? What happened when we tried to pass the Affordable Care Act, right? Which was a Herculean effort that cost a lot of Democrats their jobs, a lot of House members Everyone talks about what happened in 2010 and like, why didn't down ballot win? And was it OFA or this or that? No. A bunch of people took the vote, knew that they would probably lose because they took the vote for Affordable Care Act, but they thought it was important enough to do anyway, and they did it. The Affordable Care Act, which didn't even pass with a public option because we didn't have the votes for a public option, which still isn't single payer. We passed a bunch of insurance company reforms that put a bunch of new regulations on insurance companies, but we couldn't get more than that. Fast forward to the 2020 Democratic primary, where the central debate in the primary was over Medicare for All. And what happened there? Medicare for All ended up less popular than it started at the beginning of the primary, because when you ask people, should the government guarantee health insurance, people say yes, like 60% say yes. When you ask people, do you think it should be a government-run system or a private insurance system, more people want private insurance than they do government. That number has narrowed now, but that's still. So it is a problem with the insurance industry. It is a problem with their lobbying. It is a problem with the money in politics. It is certainly a problem with the Republican Party, but it's also, we have work to do convincing people to change this system.
So I think the key phrase there, which, correct me if I'm wrong, is inaccurate, is it's not a government-run system. It's a government-administered system. Can you correct? Because people, I understand the concept, might not trust the government to run the healthcare system, but isn't it that they're paying for it? They're not actually in the doctor's office or making medical decisions?
Boy, I would love to debate those guys. But yes, it is a doctor-run, frankly, medical system, because what you do when you have a public payer is you enable the professional clinical judgment providers to determine the care patients get. And Medicare is not a government-run system. They never make this distinction. It's like, God, Medicare is the most popular health program in the country. If people thought it was government-run, would that be the case? We used to see, a few years ago, signs saying, "Keep your government hands off my Medicare." It's pretty ironic. The truth is that when you finance healthcare and eliminate through a public program, eliminate the multi-payer waste that Matt Brunig pointed out, you simplify the system, lower cost, and increase access. That's what happens. And it's not a coincidence in 2020. I worked for the Bernie Sanders campaign as Healthcare Constituency Director, and I was in Iowa. Yeah, they spent at least $1.5 million attacking Senator Sanders on Medicare for All. The 2020 election wasn't about Medicare. It was about the centrists leaving the field at the behest of President Obama and creating a one-on-one matchup. And everyone knew in February that unless they did something dramatic, Bernie Sanders was going to be the nominee. And he would have beat Trump in 20 like he would have beat Trump in 2016. So the notion somehow that his support for Medicare for All was a political problem wasn't true. And the other false statement there, among a few, that was made was this Affordable Care Act cost people the elect, cost them the House. Members voted for it knowing they would lose. It was presented at the time, Jordan, as a political winner, that we were going to do this. You remember this, right? We were going to universal health care, and the Democrats would be the majority party for the foreseeable future. They presented it as a win. We were telling them, no, it is not a political win, because people are going to see it for what it is, essentially a windfall for the insurance industry. And the fact that they couldn't get the votes for a public option has everything to do with the lack of political will on the Democrats' part. What we saw in 24 was even worse. The Democratic nominee never talked about health care.
Right.
It was just a non-issue. And yet every single survey said that the cost of health care, along with rent, were probably, and groceries, were the three drivers for the concern over inflation. There's no program to control healthcare costs when you can charge anything you want. And the notion that they, made a Herculean effort to pass the Affordable Care Act, when they essentially cut a deal with pharma and the insurance companies to get it through, I'm not sure I would buy that description.
And my last question, I mean, obviously, as in mass shootings and all the rest, the media will move on from this. But, I do, and politicians certainly don't want to talk about this. But at the end of the day, I don't think the sentiment is going to go away. I don't think the outrage is going to go away. We will see a trial for this alleged killer. Now you have corporations scrambling for tighter security. Not that you have a crystal ball, but where do you see this going from here? And what do you think the opportunity is? Because it sure seems that in a political system where there's not much, both liberals and conservatives can agree on it. It does seem like this is an area people across the board are agreeing on.
That is what's remarkable about this moment, is the cross-partisan support for fundamental change in the healthcare system. And that's the other thing that Pod Save America doesn't address, which is when you ask the question, does the healthcare system need a little change or does it need fundamental change? For the last 2 decades, fundamental change has commanded a majority. And frankly, people understand corporations have too much power in this country. Government as a countervailing force has been delegitimized by, say, Democrats' complicity in the corporate power structure and Republicans' propaganda. So what I see happening is a recognition in healthcare, as we've all often said, it can be a leading wedge issue to bring people together across this partisan divide to really take on the corporations that are killing us. And I think it's possible. I think this moment has opened up that possibility. And as much as we are, expressing condolences to the family of Brian Thompson and all of those affected by gun violence, and in fact, corporate power helps perpetrate that as well, we understand that a political moment has opened up for real change, I think, in healthcare, maybe more broadly.
Absolutely. Thank you for taking the time. Michael Lighty, fellow with the Sanders Institute, and you've been fighting this fight for a long time, also with People's Action. We'll stay in touch.
Thanks, Jordan. Really appreciate it.